Assalamu alaikum, everybody. Today we are going to discuss how to take a history in cases of substance. So we are going to know the following. We have to know the history items that we should ask about. Also, we should know about the mnemonics that we can remember how we ask about the drug history. Also, we will illustrating the all items of history that we should covering during this. It is more for clinical training, it's better if you make a role play with your friend or your colleague, one be a doctor and one be like a patient having a problem with substance. This can make it so easy and make you practice this well in the exam. So, for example, this is like a form that you are facing. You are a medical student, asked to see Mr. X, whatever his name. He has a problem with substance use. So, usually it is like saying that you are required to communicate with patient in efficient way, and at the same time having complete history taking, including the complaint, the history of patient illness, the past history, the family history. You have to closure for the interview and discussing the diagnosis and plan of management. So during the closure, you are telling the patient, like doing a summary and telling the patient what is the problem he is already suffering from, and you told him what are you going to do in order to manage this. So usually we have to, when we start like asking patient about like problem of the substance, we have to address the point of confidentiality. So at this point, you have to tell the patient, I'll ask you some questions regarding your personal life, and I would like to tell you that everything will be confidential as the rest of other items. So this is like some point we have to consider in the communication skills. It is not just for substance, but for any history taking, how to introduce yourself. You tell the patient your name, your role, what are you going to do today. You have to assess the patient current knowledge of his problem. How much do you know about the problem, or how can I help you today during the history taking? Your eye contact, your posture, your facial expression. You always encourage the patient to speak, like you ask him questions, you try to assess if he understands the point or not. You have to ask the questions like in small point. You have to even if you give him the information, you have to give it like in small point, not a large amount. Avoid to use the medical like terms, because the patient doesn't understand what this means. If you say a medical term, you have to explain it in a simple way to the patient. Also, check the patient is following you. Avoid the long monologues. All right, so this is like mnemonics. You usually like these mnemonics to remember easily. So if you want to know this mnemonics easily, then we are going to discuss it in details soon. The treatment history, you have to ask the patient if he is like addressing the point of the treatment in the form either in detoxification or 12 steps program or medication, and how this treatment was successful, for how long this treatment continue. So this is important. What where was the setting of the treatment? Was this in the hospital or the outpatient setting? So you have to give details of the treatment and how many times, what is the longest time of a distance from the substance. So you have to take it in details. So you can have like 7 times, 4 times, 8 times. You have to know what was the longest time of his abstinence and when was it. So you have to know this. The route of administration, you have to ask the patient about how he take these drugs, either like is taking smoking or orally, or like snoring or inhalation or injection. So the amount this including the amount, like the money he spent for this, or maybe like also like the time he spent for this. You have to tell him about this. The pattern of use, if you take this like daily, occasionally, twice per day, like in certain times, what are the time of the heaviest use? If the patient have abstinence before, you have to ask him how was the longest time, what has helped you the most. The effect of the drug, either physical, social, psychological, like legal issues that the patient enter for this. The duration of use, like when was the first time you used this drug, and you have to make a detailed information about the current or the recent use, because sometimes a patient coming have a problem with certain substance, for example, like heroin or something like this, and he doesn't address the other substance. So in this point, you have to let him tell you about the other substance he used and when was the first time. So let's doing this like in more details. When we're having a patient having his complaint, you tell him about his complaint. Then we have to discuss this like the present history, like onset, course, duration. And here, the present history will covered by the items of the drug history. The past history, either past medical history, past psychiatric history. The family history, you have to ask for family history of substance or family history of psychiatric disorder. So the drug history, you have to ask the patient if he say, Doctor, how can I help you today? Yes, doctor, I have a problem with the substance. Then you have to ask him, can you tell me when this is started? Like for how long? How this happened? Then you tell him about if you take, I have a problem with, for example, cannabis, then you tell him how much do you take, how do you take it, how often do you take this, how many times you take it, like, then he say daily or every other day or twice per day. Then you have to analyze the other substance and the smoking, like he can having a problem now with cannabis, but he is already taking other drugs, but maybe at the same time while he is taking cannabis, he have a problem with the other drugs, but maybe this is not the point of his interest, or he take it like not commonly, or maybe he is coming now because of problem of cannabis, but he's already have a problem with other substance. So you have to address this point. You have to ask the patient about the cause that he let him starting abusing the drugs. You have here to address the point like of substance use, the diagnosis, like tolerance and withdrawal. Did you increase the amount you take every day? Did you try to stop down? When you try to stop down, do you have any like symptoms like of withdrawal, like you feel pain, you feel like this psychologically? So you have to ask this. If the patient have attempt to stop the drugs, how many attempt? What was the last time? How long did it take it? What helped you the most in this attempt to stop? You have to ask about hospitalization, about the longest time of abstinence. If the patient is relapsed, what the cause of his relapse? If this is like the use of these drugs causing him like legal problems, family problem, financial problem, functional impairment, if there is history of suicidal attempt. Sometimes, or in a lot of cases, we having like a patient suffering from substance and may having like a psychiatric disorder, or sometimes we're having what we call a double diagnosis. That's a patient can having like a substance use disorder comorbid with bipolar disorder, or comorbid with schizophrenia, or comorbid with depression, or comorbid with borderline personality disorder. So we have to ask about this. This is why we should address this in the history and past history. And it's actually commonly that this suicide present because of frequency of personality disorders are high with patients with substance. So the last but not the least, if you want to do this efficiently and do it very well, you have to practice. You have to make like uh, one of you like a patient, and one of you, the others, is like the doctor, and you have to tell your friend like the items that he is going to tell you, or he can imagine what he will say for you about this, and then the other one will taking the history. This is will make it so easy. Thank you. I hope you enjoyed this skill. Thank you.